What is cocktail impression technique? When you have severely resolved mandibular ridge, instead of making a handle in the custom tray, you make rest in the region of the molar area with increased vertical dimension so that the maxilla will hold the mandible and the tray in the position. Over those rests, you place impression compound so that you can register the maxilla properly. Rests of the custom tray will fit into the maxilla and maxilla will stabilize your custom tray. Also, you will make lingual portion of the rest concave so that your tongue can move freely inside the oral cavity during the impression procedure. Now let's talk about impression material. For the impression material, you choose admix technique, that is 3:7 ratio of impression compound and green stick, and you mix them in the 60 degrees Celsius temperature. You make a homogeneous mixture, load into the tray and place the tray in the patient's cavity. You ask patient to close in that increased vertical dimension and ask patient to do different functional movements like sucking the cheeks, sucking the lips, swallowing. After 90 seconds, when the material is set, you remove the impression and inspect it. You do not have to trim, you do not have to remove or add material because it will distort the impression. So the impression is the final impression. Why do we call it a cocktail impression technique? We have used the dynamic impression technique by Triday using the rest in the impression tray. We also have used the McCord and Tyson impression technique or the Admix impression technique where we used impression compound and green stick. Also, we have used the functional impression technique and closed mouth impression technique. Because of the mixture of all these techniques, we call this technique as a cocktail impression technique.